This is a second video in the series on fatty liver and will discuss risk factors. Let's now discuss what are the risk factors that cause fatty liver. So what happens is that some of this excess glucose is converted to fat by the liver and stored within the liver cells as fatty deposits, resulting in fatty liver. There are many conditions in which this phenomenon can occur. One of these conditions is diabetes mellitus, where blood sugar levels are high, and this stimulates fatty deposition in the liver. Consumption of a diet that is rich in carbohydrates and calories. Most of the carbohydrates that is consumed is broken down into glucose in the intestine and absorbed. The glucose is then distributed to various parts of the body, including the liver. When we take a rich carbohydrate meal, particularly if it is refined food items like white rice, there is a sudden spike in the blood glucose. This rapid increase in blood glucose is believed to stimulate the conversion of glucose into fat droplets within liver cells. Let's now discuss about insulin resistance. Insulin is a hormone that promotes the movement of glucose from the blood into the cells like muscle and fat cells. There is a gate or receptor which controls the movement of glucose from the blood to the cells. Insulin helps to unlock this gate in healthy persons, as is shown here. In a healthy person, the opening of the gate is smooth. However, in insulin resistance, there is something wrong with the unlocking of this gate. This makes it harder for the glucose to enter the cells. As a result, there is a buildup of glucose in the blood. The excess glucose then moves to the liver, where it stimulates fat formation. Being overweight or obese is another cause of fatty liver. Being overweight is associated with fatty liver. The reason for this is that most overweight patients have insulin resistance. The more one is overweight, the greater the insulin resistance. A person is considered overweight if the body mass index or BMI is above 25. The higher the BMI, the greater the risk of fatty liver. Distribution of fat is important. Fat that accumulates in the abdomen is called belly fat and is particularly bad for the liver. In medical terms, belly fat is called central obesity. This slide shows you images of belly fat or central obesity. Belly fat is worse for the liver when compared to fat found in arms, legs, and buttocks. Some people with normal BMI may have excess belly fat. They too are at an increased risk suffering from fatty liver. Another common condition is called metabolic syndrome. Metabolic syndrome is a medical condition where patients are overweight, particularly with fat in the belly, have insulin resistance and fatty liver. They also have a combination of other medical problems like high blood pressure, high blood sugar, and high cholesterol and triglycerides in the blood. Metabolic syndrome is diagnosed when 3 out of the 5 things that I've circled here are present. Some patients have an additional health issue on top of fatty liver, namely heart disease. The high blood pressure, sugar, and cholesterol increases the risk of coronary artery disease in the metabolic syndrome. Other causes or risk factors for fatty liver are high levels of lipids. There are 2 fats or lipids that are important in causing fatty liver. They are cholesterol and in particular triglyceride. High blood levels of both of these fats results in accumulation of fat deposits in the liver cells. Underactive thyroid gland can also cause fatty liver. In medical terms, an underactive thyroid gland is called hypothyroidism. In this condition, the blood levels of triglycerides tend to be high, resulting in fatty liver. Another risk factor is high levels of fructose in the diet. Fructose is a type of sugar that causes fatty liver. Fructose is 5 times more likely to cause fat accumulation in the liver compared to glucose. There are certain foods that contain a lot of fructose. One such high fructose containing food is high fructose corn syrup. High fructose corn syrup is found in all kinds of sugary beverages, snacks, biscuits, sauces, and processed foods, as is shown in this picture. High fructose corn syrup is used as a sweetener as it is cheaper than natural sugar. Now, there appears to be a strong link between this fructose syrup and fatty liver. I will discuss this in greater detail in video 5. Certain medicines like steroids can cause fat accumulation in the liver. There could also be genetic factors. Sometimes several members of the same family suffer from fatty liver. This suggests there could be a genetic factor predisposing a person to fatty liver. Another risk factor for fatty liver is obstructive sleep apnea or OSA. Obstructive sleep apnea or OSA is a condition which is marked by snoring and interruptions of breathing at night. Both OSA and fatty liver tend to occur in overweight or obese patients. In OSA, there is a recurrent closure of the upper airways, as is shown in this image. The tongue and the palate flop backwards, blocking the airway. This results in a temporary fall in the blood oxygen level, which is believed to worsen fatty liver. OSA or obstructive sleep apnea is linked to other conditions like daytime sleepiness, tiredness, fatty liver, insulin resistance, hypertension, diabetes, heart disease, and even stroke. Hence, those with fatty liver, particularly those who are obese, are often screened for OSA. A test called a sleep study is used to diagnose OSA. There is effective treatment for obstructive sleep apnea. There are currently studies going on as to whether treating OSA will help to reverse fatty liver. Another risk factor for fatty liver is chronic hepatitis C. Patients with chronic hepatitis C often present with a fatty liver. Hence, all patients with fatty liver are screened for chronic hepatitis C. Of course, only a tiny fraction of patients with fatty liver have chronic hepatitis C.